deficit, I wish to say a couple of words on another topic that has already been covered very well, i.e. diagnosis, because identifying such a deficiency, especially at an early stage, especially when the causal agent can be removed, like in abuse or misuse of contact lenses or eye drops, is very important. So the tests that may help us make a diagnosis are very numerous, but the basic tools is the staining of the ocular surface by means of fluorescein. If we take a look at these pictures that have already been shown by Lorena, you see that there is a staining in the 2 or 3 o'clock up, and this appears lately, and this is the sign that there are conjunctival stem cells at the cornea. So if we could recognize this early sign here, this patient was a contact lens wearer, we can urge the patient to discontinue contact lenses, and here in particular where the limbar deficiency hasn't yet involved the whole limbus, we may consider that other or residual stem cells are still functioning. Whereas when the signs are more evident here, for instance, the deficiency is present at 360 degrees, the situation is no more reversible, and so the ocular surface has to be reconstructed surgically. So when we see an eye, we want to stain it, and we expect to see something of this kind. So this is fluorescent and blue light staining. The third one has a green light filter that helps us a lot. And here you may see a caustication, a chemical burn, which has a very evident vascularized panus, and as we may see from the whole staining, and this filter helps us identifying even better the late staining. Very often we heard, how can I diagnose a limbar deficit? My patient had a vascularized cornea, so this is it. No, that's not true, because cornea vascularization isn't sufficient nor necessary as a sign to make a diagnosis. If you see, this is a patient of about 60 years old. He has a very severe dysfunction of the meibomian glands, and here the deficiency is total that went undiagnosed. On the fellow eye, he received a PK that didn't resolve his problem. And Lorena has already showed us that 70% of patients receives keratoplasty without a previous transplantation of stem cells. 22 eyes had received multiple keratoplasties. All of them failed for total limbar deficit. And this is very important. It should be avoided because not only did not help our patients, but we even made their situations worse, because from an immune privilege, we actually have turned to immune alert. And so we have probably compromised the possible limbus transplantation procedure in the future. But let's now come to the true topic of my presentation. It is to say medical treatment. The first goal is to bring the inflammation in control, both in cases of burns, because it is the inflammation that actually perpetuates the loss in the ability of functioning of the stem cells, of the surviving stem cells. But in particular, when we have autoimmune problems that cause the deficiency, and in the case of the pemphigoid, for instance, these patients should be treated systemically and chronically, because otherwise we won't actually take the right care of them. So these patients, once we have brought the inflammation into control, we should remember that the residual surface is no longer normal, so they have a residual deficiency that might cause a relevant dry eye, and in most severe cases, even alterations of eyelids anatomy. All conditions that should be surgically reconstructed before a possible transplantation. And then talking about the dry eye, So artificial tears with no preservatives, punctums, and what is really important is topical steroid eye drops and cyclosporine, especially in cases deriving from autoimmune conditions. Also, systemic immunosuppressors should be used, or therapeutic or contact lenses, and even sometimes tersography. Of course, the meibomian glands should be considered even when, both when they are the main cause or when they are just a contributing factor. And so in this case, oral doxycycline should be used. And in case of chemical burns, we may add to everything I already said, the oral ascorbic acid, which helps the release of collagen, and so may also help with the sterile ulcers in cases of severe burns, or citrate eye drops that maybe inhibit the collagenase action of the inflammatory cells. And then, however, it is better to use oral drugs like acetylamides, and avoid eye drops that might have a toxic effect. In specific cases, here you have the ocular pemphigoid. This is taken from Dr. Holland's book, Ocular Surface. I suggest, recommend everybody to read it because it's very clearly understandable and very, very useful. Let me remind you of the possible use of the amniotic membrane, not as a final solution, because it doesn't actually bring any stem cells, but because it may contribute to the healing and also acts as a conjunctival filler. And I think that we do not have here in the acute stages of a severe burn or a Steven Johnson can even help prevent the formation of a symblepharon. Thank you so much.